Hello, welcome back to the diabetes lectures. So today we will be discussing about diabetes education courses as relevant to the specialty certificate exam. My name is Santosh Abraham. I'm working as a specialty registrar in diabetes and endocrinology at Scarborough General Hospital. Today we will focus on 4 programs: Daphhne and Bertie for type 1 diabetes mellitus, and Desmond for type 2 diabetes mellitus. An expert for type 1 diabetes mellitus and type 2 diabetes mellitus. Expert is actually recommended if patients cannot commit to Daphhne. The type 1 patients can come into expert. So what is the benefit, or what is the purpose of all these education programs? So they want to improve the knowledge, skills and confidence of people with diabetes, and these programs enable them to take increased control of their own lives and integrate effective self-management into their lives. So a high quality structured education will have a deep impact on outcomes and can undoubtedly improve the quality of life. These are the components of diabetes education program as recommended by NICE. It should be evidence-based and it should suit the need of the person. So there should be evidence to support this program, and also regarding the suitability, it should be that need should be met. It should have specific aims and learning objectives, and it should support the person and their family members and also carers in developing attitudes, beliefs, knowledge and skills to self-manage diabetes. So focusing on these attitudes, beliefs, it is very important because that will reshape the management of diabetes further. It should have a structured curriculum. It should be based on theory, evidence, resources, effective resources, and should have supporting materials and should be written down in a good format. It should be delivered by trained educators, doctors or nurses or whoever, who have got an understanding of educational theory appropriate to the age and needs of the person, and who are trained and competent to deliver the principles and content of the program. So healthcare professionals who could do that, who are trained and who are competent in this area, could deliver this program. It should be quality assured, and it should be reviewed by trained and competent assessors and independent assessors who measure it against criteria that ensure consistency. That is, these assessors should be independent. They shouldn't be linked with the program. And quality assurance is very important. Otherwise, it will be a big flop. And the outcomes should be audited regularly. That's also for improving the overall efficiency of the program. These are the potential benefits perceived. So improving knowledge, health, beliefs and lifestyle changes. As I've told you before, improving beliefs is very important, and hence attitudes too, and which will influence the lifestyle. Improves patient outcomes. These programs improve patient outcomes really. They help in weight management, HbA1c, lipid levels, smoking and psychosocial changes. Also improves levels of physical activity, maybe more involved in exercising, and reduce the need for and potentially better targeting of medication, that is, which we all aim for, and other items such as even strips could be reduced. The need for the strips could also be reduced, and it could decrease potential economic burden. For people with type 1 diabetes, usually we suggest a dose adjustment for normal eating, otherwise called the Daphne program. But if they cannot commit to the Daphne program, then you advise them about the expert insulin program. You can also suggest the Bertie program, which was actually developed by the Bournemouth Hospital, but it is also locally run now in more than 40 centers, and it also has an online course. Even the expert has got an online module. And there are also many locally run courses and insulin pump courses in addition to this type 1 diabetes in the entire UK. And for people with diabetes type 2 diabetes, we usually recommend diabetes education and self-management of ongoing and newly diagnosed patients. That's the Desmond program. The expert diabetes program can also be suggested. The expert insulin program is suitable for people with type 2 diabetes who require insulin, and also for type 1 diabetes also. Other programs are Empower Diabetes programs, and Diabetes UK collaborating with Bupa have designed an online education program for T2DM. So coming to Daphne, which is the most important I think here. Daphne stands for Dose Adjustment for Normal Eating. It is a way of managing type 1 diabetes for adults, and it provides the skills necessary to estimate carbohydrate in each meal. And it also gives training so as to inject the right dose of insulin to adjust basal and bolus doses. The course covers a broad range of issues including hypoglycemia, and also it helps them to adjust insulin for exercise, also altered requirements in case of alcohol intake, or what to do with insulin during illness. So these are the main areas which a Daphne course covers. They will give education regarding the pathophysiology of diabetes, types of diabetes and metabolic control, and different kinds of insulin, their types, actions and duration, food and nutrition, especially about the calorie content and about their carbohydrate content, and then about portions, which is very, very important, and the concepts of these portions and the glycemic index, which is excellently covered in this course. And then they teach them, the participants, to adjust the short-acting insulin to the CH portions, the carbohydrate portions, and the glycemic index of a meal. They also focus on avoiding weight gain, also give advice on sweeteners and sugar substitutes, alcohol, insulin and diabetes, and dose adjustment for snacks too. Other areas are, they have a stepwise approach to dose adjustments, and also they teach how to deal or manage hyperglycemia and hypoglycemia as well. So regarding hypoglycemia, they teach about the awareness of hypoglycemia, the symptoms, and then how to treat it, and then how to adjust insulin following hypoglycemia, and also insulin doses needed for physical activity and exercise when there are alterations required. Then about food care, about travel in type 1 diabetes, about driving in type 1 diabetes, and about pregnancy and contraception also. So you can see that it's a broad course actually. It covers a lot of things, which is in fact very essential for a person with type 1 diabetes. And more than medications, education has the most important role in managing these patients. The structure is designed so as the patient can lead a normal life as possible. And it's a 5-day training course, and there is a follow-up session after 8 weeks. A group consists of 6 to 8 participants under the supervision of a Daphne trained personnel, and the learning is mainly from experience. It's from shared experiences, and they really practice the skills of carbohydrate estimation and insulin adjustment in this course, which is very important for these patients. The advantages are, it has proved to improve the general well-being, treatment satisfaction, and improve dietary freedom, because it allows people to fit diabetes into their lifestyle rather than changing their lifestyle to fit in with their diabetes. This is an important component of Daphhne, to fit diabetes into one's lifestyle. Also, it has shown that it reduces the frequency of hypoglycemia and improves overall glucose control by a lowered HbA1c over course of time. This was a study which compared various long-acting insulins in the Daphhne group and what was the mean HbA1c reduction. So you can see that NPH had the greatest reductions, caused the greatest reductions in HbA1c. So NPH is actually recommended by the Daphhne program as a basal insulin. So twice daily NPH insulin was associated with greater improvement in glycemic control over a period of an year. And most patients remain on the same basal insulin after the course. And twice daily basal insulin is also associated with improved glycemic control for people who are prone to hypos. There was a significant reduction in severe hypoglycemia with glargine at 12 months. So it is, and it's a benefit with glargine. And hypoglycemic awareness improved with all basal insulins. And there were no weight differences between the different insulins. Now let's come to Bertie program. So Bertie again is for type 1 diabetes. It stands for Beta Cell Education Resources for Training in Insulin and Eating. It is designed to help people with type 1 diabetes learn more about managing the condition and about useful topics such as carbohydrate counting and how to work out insulin doses. So anyone with type 1 diabetes who is above 16 is eligible and can attend the Bertie course. Even the patients with type 2 diabetes who are poorly controlled and with multiple daily injections are considered, but it's mainly for type 1 diabetes. So people who want to participate in the Bertie course should be on the MDI treatment involving a fast-acting insulin with meals and a long-acting insulin. That's a prerequisite. If they are not treated with the MDI, such as those on twice daily, if they are not on the basal bolus, they will be encouraged to switch on to these before the course to the basal bolus, but may be still included if they are if there are spaces or if it's really needed. So it's a 6-hour group program once a week for 4 weeks. It's led by DSN and a diabetes dietitian. So it teaches how to count carbs, how to adjust insulin doses accordingly, and participant will have records of food intake, blood glucose levels, and insulin administered between sessions. So it's really a good course. You can titrate your insulin doses according to your total dosage and requirements and according to the insulin sensitivity in the presence of a supervised personnel. And the street-wide section in the Bertie is for young people. The LiFi section is a beautiful section which gives support and advice on issues including psychology, pregnancy, illness, and hospital admissions. Now coming to Desmond. So Desmond is a way to learn more about type 2 diabetes. Desmond is a resource to help manage diabetes related changes, and again it is a way to meet and share life experiences with others. The contents of the Desmond program are thoughts and feelings of the participants around diabetes, understanding diabetes and glucose, what happens, understanding the risk and complications, and associated with diabetes, how to monitor and how to monitor the medication, how to monitor your blood sugars, how to take control, what good food choices you can have, how much of physical activity, and how to plan for the future. These are the modules and toolkits in the Desmond program. This is for the newly diagnosed and foundation. You have a My Desmond program here, and then it's for prevention. Let's prevent diabetes and walking away from diabetes. There's a module on Ramadan, as well as for ethnic minorities. There is another module. I'm sorry, it is a toolkit actually for the ethnic minorities. And there are 3 different Desmond programs. One, as I've told you before, for newly diagnosed, for foundation, for people who are already having diabetes. So foundation is for diabetes, established diabetes, and Desmond newly is for for the newly diagnosed patients. And Desmond BME is for the ethnic minorities. And 10 people comprises a group here, and with type 2 diabetes, and it is built around group activities. You can always speak to an educator. I think it is basically has got a psychological approach. Well, every course has got that, but I think the Desmond specifically has tries to understand the patient more, the educators there, so they got a psychological approach, and they explore more into the patient's understanding about various conditions, and then they try to teach from there. Finally, coming to the expert health program. So it runs in 3 different formats. It is for all types of diabetes. So it is for people with different types of diabetes, as well as those at the risk of diabetes even. So expert prevention. So it is an intensive lifestyle program which focuses on reducing the risk of developing T2DM with people at high risk. Expert diabetes, already who have diabetes, for people with type 1 and type 2, with an emphasis on their lifestyle choices. And expert insulin for people with 1 and 2 who are treated with insulin. So people who cannot commit, type 1s who cannot commit to Daphhne, can do the expert diabetes. So it gives guidance to what diabetes is, carbohydrate awareness, how physical activity can help, understanding about the food labels and complications of diabetes, how to avoid hypos. This is mainly a part of the expert insulin course. And how to prevent diabetes. So it runs in 6 weekly sessions, and a session consists of 2.5 hours. It lasts for 2.5 hours. It is done in local communities, and there are follow-up sessions after the course. The courses are run by trained diabetes educators such as the DSNs, and also people who are either diabetic themselves or work as diabetes specialists. So they could be even the patients as well in expert programs. So these are the expert programs, different types of expert programs. This is for the expert prevention. This is the expert diabetes program for who are with type 2 who want to get treated. An expert insulin program, either with type 1 or type 2. For type 1, especially on people for type 1 who cannot do the Daphhne or fail the Daphhne, they'll come to the expert insulin. And there's a taster session even, that's called the first steps. And another module, another program on weight management, beautiful program. So about choices on diet and flexibility, and also about exercise. Thank you.